Modern Western culture has contributed many great achievements to humanity. In our media-rich, celebrity-obsessed world, we often get the message that being thin is a recipe for success and happiness. Hello and welcome to Open Forum. I'm your host, Nicole Fox. Our program has previously investigated the eating disorders of anorexia and bulimia. Today, we take a close look at the newly recognized problem of binge eating. Many may be surprised to learn that binge eating is a compulsive behavior disorder that affects several million Americans. Even though binge eating is still not officially classified by the American Psychiatric Association, therapists and psychologists have been treating people who needed help overcoming this painful affliction for over 2 decades. Today, we'll introduce you to some knowledgeable experts who will help explain this mysterious disorder and shed some light on how to deal with it. Dr. Catherine Henderson is the clinical director at the Yale Center for Eating and Weight Disorders. She and her team study various eating-related mental health issues.
Binge eating disorder is the newest recognized disorder in what we call the Diagnostic and Statistical Manual. That means Book of Psychiatric Disorders. In fact, it's so new that it's actually not recognized as a formal disorder yet. It's in the appendix, one of those research disorders, but we expect it in our next edition of the Psychiatric Diagnostic Manual to be recognized as a full disorder.
Many of us know what anorexia and bulimia are, but what exactly defines binge eating disorder?
It is defined as eating what most people would regard as an unusually large amount of food in a relatively short period of time, and not compensating for that overeating.
This is a pattern that Linda Layton has seen many times. Miss Layton is nurse manager for the eating disorder unit at Somerset Medical Center in New Jersey. She explains how binge eating differs from other eating disorders.
Binge eating disorder is a little bit different from what you may have heard about anorexia, which is really restricting what you eat, and some of those patients are very thin. Bulimia nervosa is the other end of the spectrum, where patients typically will eat a lot of food and then they'll purge the food or they'll get rid of it in some type of way that is unhealthy. They'll self-induce vomit, they'll use laxatives, they'll use diuretics or water pills, they'll over-exercise, they'll do a lot of things that are quite negative on the body.
But diagnosing a person as a binge eater is not as simple as that. There's another very important psychological component to this condition.
The other aspect to the eating is that they have to experience a loss of control. So not only are they overeating, but they feel like they're out of control. They couldn't stop eating. If they wanted to, they can't really control what they're eating or how much they're eating.
Miss Layton agrees. She speaks to the difficult reality that many sufferers of binge eating disorder face every day. That is the perception of being looked down upon by the rest of society. That feeling of inadequacy or persecution may lead some to feel out of control and helpless. The sense of losing control over your own life is a debilitating mental state that can lead many to emotional problems. Jane has first-hand experience with those feelings. She agreed to sit down with Open Forum to talk about her recovery. For privacy reasons, we will not be using her real name. Jane begins by telling us how her own struggle with binge eating disorder began.
It started very slowly at first, and I don't even think I realized what the problem was. Originally I started just normal 15-year-old, had always been thin and felt that I was gaining weight, didn't like it, started dieting, and really never had a binge up until age 15, 16. Didn't even know what it was. And I would say the first time I ever binged was more because I started dieting, and I was like starving myself and didn't even realize it. And it was as simple as like I started eating and then just had this feeling of not being able to stop.
As with most people who suffer from such a serious eating disorder, Jane's journey was long and painful.
It's not like overeating at like a party or a restaurant. It was definitely secretive, did it alone in my room. Felt like I had to hide it, felt like I had to hide food. So it became, you kind of become a slave to it.
The research about this illness is still in the early stages, but one factor seems clear. Binge eating disorder seems to afflict people who are already suffering from some other psychological problem. The eating disorder may actually be the result of abuse or some other traumatic experience.
When we see patients, it's sort of the tip of the iceberg. What lies beneath are a lot of risk factors associated with binge eating disorder. We've found that there has been a lot of issues of trauma, whether it's been some type of abuse. It could be physical abuse, it could be emotional abuse, it could be sexual abuse. Lots of times these patients have been bullied as kids. These types of patients have a lot of difficulty with being very sensitive about themselves, obviously, very sensitive in their family structure. They have a lot of difficulty with identifying what feelings they feel. They're scared to show how they feel. They're scared to show their anger. They're scared to show their depression. They're very sad.
How does an eating binge affect a person's ability to cope with stress?
They tend to use a lot of their behaviors as far as the binges because what it does for them is it provides comfort. If they have a particularly bad day, they may stop at the bakery and get whatever food items to make themselves feel better. What it does is it takes the edge off the particular emotion that they're feeling, and that's why they do it. They binge because it makes them feel better. They binge so they won't feel the acuity of the feeling.
Any momentary comfort that a binge may bring is negated by the possible long-term damage to one's physical and mental health. The psychological aspects of this compulsive behavior are complex and not fully understood. However, the physical effects of binge eating disorder are clear for all to see. Not everyone who suffers from compulsive overeating is also overweight, but the percentage of binge eaters who are obese is quite high. The negative health effects of obesity are well known. How do people become trapped in the painful cycle of binge eating? We'll find out when we return on Open Forum. As we've seen, binge eating disorder is still not well understood. It encompasses a complex mix of psychological and social pressures. In our popular culture, being very thin is regarded as natural and extremely desirable. Media's influence may be a factor in causing anorexia and bulimia, but it's much more difficult to point to popular culture as a contributing factor in the psychology behind binge eating. If binging causes sufferers to gain weight, doesn't that mean that the media has no effect on the mindset of those who do it?
There's an awful lot of debate in the scientific communities about how culture might be affecting binge eating disorder.
So anorexia, bulimia, and binge eating disorders do in fact start from the same neurosis, the unhealthy obsession with being thin. Being on a strict diet to lose weight can cause many negative side effects. Failing at a strict diet may trigger some people to lose control and go on an eating binge. Dr. Henderson cautions us about the difference between those who are overweight and those who may have a real psychological problem. They don't necessarily go hand in hand.
I'll distinguish being overweight or obese from having binge eating disorder. So most people who develop binge eating disorder eventually become at least somewhat overweight. But it's not true that most overweight or obese people have binge eating disorder. So it's a fairly, small percentage of them.
What does that small percentage go through in their daily lives?
They may be walking down the street and you might happen to look twice. You may turn around and think, wow, how can that person be so overweight? How can they be so obese? The one difference is this particular patient has a biological drive to overeat. It's not like somebody who doesn't have a binge eating disorder or an eating disorder where they can push away from having one serving of something.
Jane knows all too well how bad it feels to be seen in that way.
Well, my physical appearance definitely was an issue because I had always been very thin growing up, and I think part of the reason I got this illness was I felt that I was always valued for being petite. And when I started gaining weight, I was thinking, well, why is anyone going to like me if I'm not thin? I don't think that people realize that this is truly an illness, just the way alcoholism, drug addiction, gambling. It is a physical and psychological addiction. And I don't think people are sometimes sympathetic. They think, oh, look at that fat person, they should just watch what they eat.
Those who suffer from this disorder may also struggle with addictions and other unhealthy behaviors in an attempt to numb the real emotional stress and pain they may be hiding from.
For eating disorders, and certainly that includes binge eating disorder, a lot of the behavior is addictive in the sense that they know that they're feeling uncomfortable and they self-medicate. A lot of the groups that we run in the inpatient service, there's a lot of similarities between really wanting something so badly that a lot of these patients also have addictive problems with substances, whether it's alcohol or drugs. And they actually will say it's very similar to wanting to get high or feel high so that they don't feel the intensity of the feelings.
As with any complex psychological process, the causes of binge eating disorder are still rather mysterious. Evidence is still being gathered and studied, but there are already some clues as to how the disorder develops and who is at risk.
There appears to be a fairly large genetic component to binge eating disorder, so it tends to run in families. And this means that there probably is something about it that's being transmitted from generation to generation.
Is there a gene that is passed from parent to child that causes this disorder?
It's very unlikely that we're going to find a gene that's the binge eating disorder gene, and if you have this version of it, you get binge eating disorder. Like most psychiatric disorders, it's probably going to be the case that that a certain collection of traits are heritable and they tend to make you vulnerable. So given a stressor or given a particular circumstance, that vulnerability will just come to be binge eating disorder.
Is there a gene that is passed from parent to child that causes this disorder? Researchers seem to be on the right track in their investigation of the genetic factors of binge eating disorder. Jane tells us about her own family history, which lends support to the theory of a genetic predisposition.
I did know relatives who were overweight and probably suffered the same thing, but at the time, really nobody talked about it. It was, if you were overweight, it was like, okay, well, cut down on what you're eating, exercise more, and, go along your merry way. And it really wasn't that simple for me.
Whether or not genetics really do play a part in this disorder is not proven. But whatever the causes, the health risks are enormous. For those who suspect they may have a problem, Miss Layton explains what the important warning signs are.
If you're wondering, maybe I have some of these characteristics, maybe I have a binge eating disorder, there are certain things that certainly will raise the red flag for you. If you find yourself eating an inordinate amount of food in a short period, which is generally within 2 hours, if you feel very guilty about eating the food that you've eaten, if you eat to the point where you feel uncomfortable, that's another sign. You find yourself eating by yourself. You find yourself just thinking about food all the time. The first thought when you wake up in the morning is, what am I going to have to eat? Every day we go through your usual daily activities and you find yourself obsessing and worrying about food and what are you going to do with the food and do you have enough money for food? Some of those things will certainly trigger in your mind that something might be wrong because you're thinking way too much about food.
Physical health is greatly affected by what and how much we eat. For those who have a binge eating problem, the medical consequences are serious.
Greater risk for type 2 diabetes, greater risk for cardiovascular disease through hypertension, through hypercholesteremia, greater risk for a variety of cancers that are related to overweight and obesity. So those are just a few of the major ones.
Healthcare professionals know that this problem is real and it's serious. When we come back, we'll ask why our society seems to have so little awareness of this issue and discuss what should be done. In American culture, the value of individual self-reliance is a long-cherished principle. For many, the idea that someone in pain would turn to food in an uncontrollable self-destructive attempt to cope is simply unbelievable. Dr. Henderson explains why this attitude may be keeping people from recognizing the real dangers and causes of this disorder.
Seeing the problem as one of gluttony, overeating, self-indulgence, I think is a huge block to having it recognized in general as a problem and getting public sympathy on board. So I think we need to stop thinking about it as a problem that the individual is responsible for and brought on herself.
A lot of people are struggling with being obese. A lot of people are struggling with their weight. And if you know that these people are willing to get help, if they're already in treatment, it's just, they need to have people around them who are supportive, people who don't judge them, people who treat them with the same respect and dignity that anybody would respect.
Dr. Henderson agrees that those who are overweight are viewed much differently in our society than those who aren't. Even though they may have an eating disorder with some of the same psychological components, a thin person with a disorder may be treated differently than an overweight person.
I think if you polled people, they would be much more sympathetic to the Olsen twins than they would be to, say, Maria Presley or Kirstie Alley or any of the others that tend to show up on the National Enquirer.
Dr. Henderson reiterates the common belief that modern American culture is extremely biased toward thinness. So much so that those of normal body weight and shape are often infected with the unrealistic and extreme definition of what it is to be normal. We've become so obsessed with being thin that normal now seems overweight. This destructive attitude is meticulously propagated by popular culture, where actresses and models are much thinner than 98% of the rest of the public. These unrealistic representations are ubiquitous.
Our dislike of fat is spreading throughout the world, and I use Latin America as an example because there's been a lot of press in the last several months about increasing eating disorders, for example, in Brazil, where I think typically the more desired figure has been rounder and the more desired woman has more fat on her, for lack of a better description, and that seems to be changing, such that girls are becoming more interested in having a more American ideal figure.
For most, the ideal American figure is not attainable. Jane takes us through the effect of depression on her condition and how depression may have been the main culprit and binge eating disorder the symptom.
I also think there's a huge, for me anyway, there was a huge depression component that I had an underlying depression that was not being treated, and it wasn't until my depression was being treated, and I think the binge eating was just a symptom of my depression.
So what happens when a person decides to get help? What are the options?
There's a lot of literature out there that says if a person is willing to come in for help, if they're willing to get help with their eating disorder, then certainly the person who's in charge of their care will get them the medical care that they need to help them with losing weight. The main thing you want to do with binge eating patients is to work with them so that they stop the binging. That's the problem. Because they're binging, they have a lot of guilt associated with that, they have a lot of shame with it.
Dr. Henderson describes the treatments that are in use for binge eating disorders.
Two behavioral treatments that seem to have the best outcome so far. They're called cognitive behavioral therapy and interpersonal therapy. Both of them are relatively short-term treatments, and so that means probably about 20 sessions. We think about that as short-term in the mental health field, so not years and years of treatment, but about 20 sessions. They're both quite focused, quite active treatments, so the therapist actually talks a lot, gives a fair bit of direction. Cognitive behavioral treatment is what it sounds like. It focuses on your thinking patterns and it focuses on your behavioral symptoms. Patients set goals for engaging in strategies to reduce binge eating, to reduce what we call dysfunctional or not very helpful thinking patterns. And from week to week they progress basically through a curriculum. It's almost very didactic. The interpersonal therapy is similar in length of treatment and in the therapist being active, but it's not focused specifically on the eating behaviors. It's focused on interpersonal issues.
Ms. Layton notes that as the number of people seeking help rises, the more important it will be to have a coordinated plan for treatment.
What's happening is that they'll come in at least for an evaluation with their psychiatrist, and there certainly has been a rise in referrals to the outpatient therapist for binge eating disorder. The other thing about binge eating disorder is they have two problems. Number one, they binge, and number two, they're obese. And what's happened in the past, certainly with eating disorders, is typically you go to a psychiatrist and they'll treat the psychiatric aspect of the illness, as well as, you know, the monitoring of the body weight and helping you get back on track where you need to be with eating nutritious meals. What's happening with binge eating disordered patients is that they're coming for help from a psychiatrist or a licensed therapist or an advanced practice nurse, and then they go to a different physician for their obesity. So there's two problems. So they're not seeing one person for both illnesses, and I think that's how they're being, somehow they're just falling through the cracks.
Jane was one of the lucky ones. Her treatment plan worked for her.
Getting treated actually was very difficult, and I went through quite a few therapists, and to be honest, I didn't know what was wrong with me, so I didn't even know how to present this. I just felt like, you know, when I went to see my first therapist, I remember saying, well, I just need to be thinner. Like, if I can just gain more control of my eating, I won't have any problems. I don't think I realized that I had a bad depression. I don't think they realized that. And it took me, I went through quite a few therapists until I actually found somebody who specifically treated eating disorders. And she completely seemed to understand what I was going through.
The good news is that the treatment does work, and a person who suffers from eating disorders can recover and live a happy life.
As much as I feel recovered, I feel like, yes, I could slip back, but I'm kind of aware of the signs and the triggers in my life that would cause me to kind of go on a spiral downward back into binge eating. And I feel, incredibly blessed that, I have a great husband, I have great children, I was able to, have a great career and really get my life together despite having had this illness.
Dr. Henderson suggests a place to begin for anyone who decides to seek help for an eating disorder.
Well, one great resource, which would be relevant for anyone in the country, so that's why I'm going to give it to you, is the National Eating Disorders Association website. They have a large resource section which involves referrals for self-help, but also involves a whole referral system or network.
Ms. Layton agrees that there are resources available and that no one should be afraid to get the help they need.
If you want to be feeling better, if you want to get back to a life that maybe you had before you developed all these issues, there's hope. The thing that people have to remember with eating disorders, it's not so much about the food, but it's about the feelings underneath and what you need to talk about and what you need to resolve, and then the food issues will go away.
The guilt didn't change the fact that I had this, and it's a very individual thing. I don't know why one person gets it in a family and someone else doesn't. But I would say to anybody who's struggling, absolutely seek help.
With treatment and counseling, it's possible to regain control of your life. With the proper therapy, work, and mindset, sufferers can overcome the psychological problems that causes the eating disorder in the first place. Then food can regain its rightful place as a satisfying and healthy part of living. Sometimes in our modern culture, it's difficult for us to be who we are without feeling judged or unfairly pressured to look or act a certain way. The self-confidence that comes from liking yourself as you are is key to resisting these negative influences. For those who need a little encouragement to gain that confidence, it's good to know you're not alone. Help can be just a phone call away. You can't be happy with your external image until you have come to terms with who you are inside, until you achieve inner peace. We hope this edition of Open Forum has brought you some useful information. I'm Nicole Fox, and we hope to see you again soon.